ready to explore some serious investment opportunities.
Oh, yeah.
Today, we're diving deep into India's healthcare sector.
Fascinating area.
It is. We've got this incredible report from NI Ayog.
They're like the big picture thinkers over in India, right?
Exactly. Basically, India's top policy think tank.
Okay.
And their 2021 report called Investment Opportunities in India's Healthcare Sector is, well, it's eye-opening to say the least.
It's not just about hospitals and doctors, though, is it?
Nope. By the end of this deep dive, you'll see this market is about economic growth on a massive scale.
And when we say massive, we mean India's healthcare sector has been growing at a rate of 22% every year since 2016.
Every year.
Every year. That's like adding another country's entire healthcare industry to India annually.
That's insane.
It is. And it's not just about treating patients. It's about lifting millions of people into better lives.
Creating jobs, boosting the economy.
Exactly. The report predicts the industry could generate an additional 2.7 million jobs between 2017 and 2022.
So like 500,000 new jobs per year, just in healthcare.
You got it.
Wow. And this growth isn't just limited to hospitals, right?
Right. India's healthcare sector is incredibly diverse. Think medical devices, health insurance, even things you might not expect, like clinical trials, telemedicine.
Really?
Yeah, and even medical tourism. And all of that is set to grow even faster as India's population gets older and the middle class expands.
Speaking of a growing middle class, this report highlights some pretty big changes happening in India right now.
Absolutely. We're talking unprecedented shifts. Over 73 million households expected to join the middle class in the next 10 years.
73 million.
That's like adding the entire population of, let's say, Germany to the middle class.
Wow.
And get this, by 2026, 8% of Indians will be earning over $12,000 a year.
Okay, so more people in the middle class, that obviously means more demand for healthcare,
Yes.
especially for things like preventative care and specialized treatments.
That's where the opportunity comes in. We're seeing this shift towards what's called medical value travel, MVT.
MVT, okay.
People are traveling to India for major procedures, things like cardiac care, even organ transplants. They can get it done at a fraction of the cost without sacrificing quality.
I've heard about that. People traveling to India for surgeries that would cost a fortune elsewhere. Makes sense, especially with healthcare costs rising all over the world.
It's a trend that's only going to get bigger. And it's not just about complex procedures either. A lot of people are heading to India for wellness tourism, too.
Wellness tourism?
Yeah. They want to experience ancient practices, Ayurveda, yoga, seeking that rejuvenation, preventative care. India's really got a unique strength there.
It's not just about treating illness anymore. It's about achieving overall well-being.
Exactly. And the Indian government is really pushing this whole transformation forward.
Well, they're putting their money where their mouth is, right? This report mentioned a massive investment in healthcare infrastructure.
Oh, yeah. They pledged a whopping $200 billion towards medical infrastructure by 2024.
200 billion. That's more than the GDP of a lot of countries.
It's a huge signal to the world. They're serious about becoming a global leader in healthcare. This kind of commitment is attracting a ton of foreign direct investment, leading to innovation, improved access to care.
So it's not just building hospitals, it's creating this whole ecosystem, right?
Yeah, and there are some key policies driving this. Take Ayushman Bharat, for example.
Okay.
It's basically India's plan for universal healthcare coverage. There's a network of health and wellness centers, mainly in rural areas, focused on preventative and primary care. Catching health issues early can prevent bigger problems down the road.
Makes sense.
And they've also got the Pradhan Mantri Jan Arogya Yojana, PMJAY for short.
PMJAY.
This one provides health insurance to millions of low-income families, so people can access care without worrying about huge medical bills.
Wow, so they're creating a safety net for healthcare, no matter your income level.
And technology plays a big role, too.
How?
They've got the National Digital Health Mission, NDHM,
Okay.
leveraging technology to create a seamless healthcare system. Electronic health records that could be accessed anywhere, telemedicine to connect patients in remote areas with specialists.
And India has incredible smartphone penetration, so it seems like the perfect place to push those boundaries.
It is. And the government's also been working to attract foreign investment by making it easier to invest in certain sectors. They allow up to 100% foreign investment in some areas, like hospitals and medical device manufacturing. Plus, there are tax incentives to encourage companies to invest in domestic production.
It sounds like they're rolling out the red carpet for investors.
They are.
And the report highlights 7 key areas within the sector.
7 key investment opportunities. starting with hospitals and infrastructure.
The classic investment opportunity. But where are the hot spots in India?
While the big cities have their share of world-class hospitals, the real opportunity is in what they call Tier 2 and 3 cities.
Tier 2 and 3 cities. Okay.
Places like Indore, Visakhapatnam, Jaipur. These cities are on the rise, growing populations, need for better facilities.
Got it.
And Invest India, the government's investment promotion agency, has already identified nearly 600 potential projects.
Yeah.
We're talking 32 billion US dollars worth of hospital and medical infrastructure development that's ready to go.
Wow. That's a lot of potential. So I've got hospitals. What's next?
Next up, health insurance.
Health insurance.
Yeah.
Interesting. How is that an investment opportunity?
Well, right now, only about 10% of India's population has health insurance. But with rising incomes and government initiatives like Ayushman Bharat, millions of people are about to enter this market for the first time.
So it's like investing in a sector that's about to explode.
Exactly. And it's not just traditional insurance models. There's a huge opportunity to create innovative products tailored to the needs of this diverse population.
Okay, I see the possibilities there. What about pharmaceuticals and biotechnology?
That's a good one. India is already a global leader in generic drugs and vaccines, but there's potential to go even further. Boosting domestic production of what are called active pharmaceutical ingredients, APIs. Those are the crucial components in medications.
Oh, yeah.
Right now, they import a lot of those from China. The opportunity here is to become more self-reliant.
Makes sense. Always good to diversify your supply chain, especially for something as essential as medicine.
And here's another thing to think about. Between 2018 and 2024, patents on blockbuster drugs worth an estimated $251 billion are set to expire globally.
And Indian pharmaceutical companies are experts at producing generic versions of those drugs, right?
You got it. Opens up a massive market. And there's even more potential in areas like over-the-counter medications, vaccines, even contract research for global pharmaceutical companies.
So lots of possibilities within pharmaceuticals. What about medical devices?
Now, this one's interesting. India currently imports almost 86% of its medical devices. That's a huge market that's ripe for domestic manufacturing.
So import substitution again? Producing locally instead of relying on imports. What kind of devices are we talking about?
Everything. Basic diagnostic equipment to high-tech imaging machines. Huge demand for everything from pathology labs to miniaturized diagnostics. Plus, there's potential in manufacturing those critical components that are currently imported.
So it's about building that foundation for domestic production from the ground up.
You got it.
What about medical value travel? We talked about how India is becoming a hotspot for medical tourism, but where's the investment opportunity within that sector?
Well, the pandemic slowed things down, but medical value travel is bouncing back strong. There's a huge opportunity to invest in upgrading hospitals to meet international standards.
So world-class facilities that can attract patients from all over the globe?
Exactly. People are looking for high-quality care at a more affordable price. And there's potential in training medical professionals to cater to international patients, developing specialized wellness tourism packages.
So combining cutting-edge medical care with India's traditional wellness practices.
Exactly.
Smart. Okay, what's next?
Moving into some cutting-edge areas now, starting with home health care.
Home health care. Why is that a promising area?
Think about it. A rapidly aging population, a rise in chronic diseases, and a growing desire for personalized care. All this points to massive demand for services delivered at home.
People want to maintain their independence and quality of life for as long as possible.
Exactly. Think home nursing services, telehealth platforms, even medical devices specifically designed for home monitoring.
Wow. So hospitals, insurance, pharmaceuticals, medical devices, medical tourism, and home health care. What's the last opportunity?
Telemedicine. All those technology-driven healthcare services.
That one's been getting a lot of buzz lately. What's driving its growth in India?
Well, incredible smartphone penetration, rapidly improving mobile connectivity. This is the perfect foundation for telemedicine. Plus, there's a shortage of doctors, especially in rural areas, and telemedicine can help bridge that gap.
Connects patients with specialists no matter where they are.
Exactly. Democratizing access to healthcare. And the market for this is projected to reach $5.5 billion by 2025, growing at 31% annually.
Wow. Where are the investment opportunities in all of that?
Well, we're talking about everything from AI-powered diagnostic tools that can be used in remote villages to sophisticated telehealth platforms for managing chronic conditions. We're even seeing growth in teleradiology services, Doctors can interpret X-rays and MRI scans remotely.
Sounds like we're on the verge of a healthcare revolution driven by technology.
We are, and that's what makes this such an exciting time to be involved in India's healthcare sector.
This has been truly eye-opening, incredible trends, a wealth of investment opportunities.
It's a dynamic market.
It is. We've covered a lot of ground today, so stay tuned for part 2, where we'll delve even deeper into these 7 key investment opportunities, explore both the potential and the challenges.